relief to see these vaccines start to be shipped out. It can't come soon enough.
Well, the vaccine cannot come fast enough as the U.S. is dealing with the worst pandemic in a century.
The vaccine can't come fast enough as the spread of the virus hits staggering levels right here in the United States.
And, you know, it can't come soon enough.
Our chief national correspondent, Matt Gutman, has the very latest in Tarzana, California. Good morning, Matt.
Hey, good morning, Cecilia. It looks like I'm standing in a military field hospital, but this is actually the ER surge area in one of the biggest hospital chains in one of the biggest cities in America. Patients are treated in here. Triage happens over there, and this place opens up once the ER fills up during the day. That, as we are seeing these unimaginable death toll levels that you just mentioned.
A new study from a South Korean medical journal found tables 6 feet apart weren't enough, that indoor diners more than 20 feet apart still infected one another.
This virus is so serious and people don't see it that way. This virus is so serious and people don't see it that way. This virus is so serious and people don't see it that way.
One of the major hurdles facing the coronavirus vaccine, getting people to take it.
Overcoming systematic racism and collective trauma will be key components in the effort to vaccinate. Now there's a full-fledged PR campaign on to remedy the situation. President Obama and several other past presidents have pledged to publicly take the vaccine in an attempt to temper fears.
Absolutely, I'm going to take it.
And Dr. Anthony Fauci, the country's most revered infectious disease expert, has made his own pitch.
So the first thing you might want to say to my African-American brothers and sisters is that the vaccine that you're going to be taking was developed by an African-American woman. And that is just a fact. To my African-American brothers and sisters.
Adriana Diaz spoke to an influential local leader in Boston who's having trouble persuading people to get the shot. Adriana, good morning to you. It is a problem.
It is a big problem, Gail. Skepticism about this vaccine, as we've been reporting, is widespread, especially in communities of color, which of course have been disproportionately impacted by this virus. So how do you undo decades of distrust? One strategy is to spread the vaccine gospel.
A source of great concern for all of us, and I would like to plead to people who are listening to this morning to really hit the reset button on whatever they think they knew about this vaccine that might cause them to be so skeptical. And I think all reasonable people, if they had the chance to sort of put the noise aside and disregard all those terrible conspiracy theories, would look at this and say, I want this for my family, I want it for myself. It is indeed astounding. In just this space of some 11 months, we have gone from a recognition of a new pathogen to a vaccine that we know is safe and effective. To a vaccine that we know is safe and effective.
Married 49 years, dying just 3 days apart. In their obituary, their children saying, in lieu of flowers, the family requests you simply wear a mask.
If people would just wear masks and would just have an ounce of consideration for other people, maybe things wouldn't be so bad and we wouldn't be sitting here, having lost both of our parents.
Tonight, the debate's still raging over lockdowns. Tempers boiling over in Boise, Idaho. During a COVID health meeting, the commissioner overseeing the community safety had her own home targeted by protesters.
Lock down Lachiondo's house.
The video posted on social media by those demonstrators. The incident being investigated by police, forcing the meeting cut short after less than 15 minutes.
My 12-year-old son is home by himself right now, and there are protesters banging outside the door. Okay, I'm gonna go home right now, and there are protesters banging outside the door. Okay, I'm gonna go home.
Infectious disease experts tell us that at least initially that vaccine won't make a dent. What will is compliance in public closures and mask wearing. It's compliance.
And if people really don't, you mentioned fatigue or outright defiance, how long could this go? Or outright defiance.
We could put an end to this in 2021 if we do the things that are right in front of us. Comply with the vaccine and do public health measures. Comply with the vaccine, comply with the vaccine, comply with the vaccine.
Scientists who have worked night and day on these vaccines to even get us to this point. It is a really exciting moment for the country.
a really exciting moment for the country.
The driving force of the work that you and Bill do, and that is that all lives have equal value. And this is really a test of that. Do we value all lives equally? And that is that all lives have equal value. And this is really a test of value. And this is really a test of it. Can you believe that in America in 2020 we are still debating masks? I mean, have you ever seen? Disinformation has been rampant, to say the least, throughout this pandemic. And it's rampant, once again, when it comes to the vaccine. What are the consequences of that?
Death. Disinformation can equal death. So if you don't do the right things to keep yourself safe, you or a loved one may die. And that's why it's so discouraging to see so much disinformation spread out there. What I tell everybody is ask your doctor. He or she knows what's best for you or your family. That's where you go for credible information, not the internet, not the internet.
But do the social media companies, Facebook, YouTube, Twitter, on and on, have a responsibility to do more right now, Melinda, in terms of getting this misinformation, this disinformation off their platforms?
They absolutely have a responsibility. Anybody who's spreading information in society has a responsibility to spread that information safely and equitably. And so, I think a bit the internet and the rise of social media has happened so quickly that really the regulations and the good policy making hasn't stayed out in front of it. And quite frankly, it needs to catch up.
The plan is coming together to get this vaccine out. So it's a tragedy. The plan, it's a tragedy, but for the entire world, it'll probably be out sometime in 2022 before we really get the coverage levels that we need to drop the numbers to be either tiny or zero.
Gates.
To be either tiny or zero. Because the U.S. has always been the leader in these health issues, HIV, malaria, the U.S. government.
Even before we conquer COVID, Gates is already talking about combating the next global disease outbreak.
It's a tragedy